Hi guys, Dr. Ian Rassel here at Corrective Spinal Care of California. Today we're talking about sciatica. And those of you that have had sciatica know how debilitating this can be. So we describe sciatica as it's a severely pinched nerve in the lower back. And there's three areas that we can have that nerve being pinched. The first area, it can be in the joints in the lower back. So this is just showing a model of a bone and a disc and a bone in the lower back. So anytime these joints, either they're inflamed or they're become degenerative due to arthritis, they can cause inflammation of the area that pinches the nerves that go down the legs, goes down into the foot. So that's one area. One is from the joint. The second area can be from the disc. So between the bones are the shock absorbers. If the shock absorbers start to wear, and mind you, it takes 10, 20 years to wear through these discs, eventually that disc will bulge or herniate and it will press on the nerves coming out of the spine. Now I wanted to share with you on the screen exactly what that looks like. So you can see here, just imagine we took all the intestines out, and here we're left with the spine and we're left with the nerves that exit the spine. And I want you guys to look at the very bottom sets of nerves, L4, L5, and then we can see the sacrum. This is a hip bone, but all these nerves come together to form one of the largest nerves in the body, the sciatica nerve. And that nerve, as you see, or on this next picture, is going to come out to the back. We're looking at the back side now, so imagine your buttocks right there, your butt's there, and the sciatic nerve goes all the way down the leg and into the foot. So symptoms of sciatica are typically going to be lower back pain, hip pain, leg pain, calf pain, and eventually foot pain. Now, if you have one of those areas, that's typically not sciatica. It's usually multiple areas. Now, some patients have pain only in the hip that goes into the back of the leg to the knee. That would be considered a sciatica. We talked about joints, we talked about discs. The third way we can get sciatica is actually from a muscle deep in our buttock called the piriformis. This is called piriformis syndrome. So at our clinic, we first and foremost need to figure out why is it that you're getting sciatica. And so to do so, we're going to research you. We're going to get a detailed history. We're going to sit down, have a consultation, and really figure out your needs and whether or not we can help you or not. As we continue on, we'll then do some specific testing, chiropractic, orthopedic, neurological, postural tests. Then we'll take standing x-rays from the front. We'll do this in-house, digital x-rays from the front, digital x-rays from the side. After that visit, we'll send you home and we'll study, we'll analyze everything so we can determine exactly, number one, is this a chiropractic problem? Is this sciatica coming from a disc, from the joints, or from the muscles? And from there we can approach your care specifically and tailor your care to your needs. And we're going to do so, number one, and most common, is going to be through chiropractic adjustments. We're going to add specific chiropractic adjustments to your spine and slowly help remodel that. Reminds me, we got a great x-ray to share with you of a patient who just recently started care and had right leg pain, severe right leg pain. So this is a back to front view. So this is the left shoulder, there's the right shoulder. We can see the spine, the mouth was wide open. Now what we can see down low is that the bottom three bones are not in their regular position. You can see we're going off to the left. We can also see big bone spurs, degeneration, arthritis. When we look at the side view gives us a much clearer picture because the side view shows a curve that goes in, it goes out, and it goes in. That's how God designed it. However, when we look down low between L4, L5, and L5S1, we can see that the spaces, see that space is a beautiful healthy space. That space is about half the size, and as we come down even further, we can see it's almost bone on bone. Remember, we're looking at the bones from the side. We can see that should have this big, beautiful, healthy space. And you can definitively see that that does not. That is the source of this patient's sciatica. We've started her treatment plan with, number one, specific chiropractic adjustments. She's seen 3 times a week over the course of several months. We have also implemented specific stretching techniques to start with the first 3 weeks of care. After the first 3 weeks of care, we're going to continue our specific chiropractic adjustments, and then we're going to add in specific exercises so we can strengthen muscles in and around her core, her low back, her hips, and her spine and legs. When we combine the stretching with the strengthening and the specific adjustments, we will slowly start to see changes. The third thing we're going to implement is going to be manual spinal decompression. We're going to show you in a minute a patient getting some decompression. So imagine if you do have an inflamed disc, a herniated or bulging disc that is pressing on that sciatic nerve. Boy, oh boy, every time you sit, you stand, with gravity, it's going to push, it's going to squish and cause things to get worse. What we'll do is we have patients lay on their stomach and we gently stretch the spine, very gentle, and that allows the disc to get off of the nerve temporarily. And over the course of several months, that spinal decompression will help hydrate and feed the disc with the nutrients that it needs. Oftentimes when patients are inflamed, meaning they're hot, it's sore, it's tender to the touch, they're in terrible pain, and mind you, the pain's not a normal kind of pain. This isn't a back pain. This can be a searing pain. It can feel stabbing. Patients will report numbness or tingling into the leg and to the shin and to the foot. These are very different pains from lower back pain. Sciatica can be constant. It can come and go based on certain positions, certain postures, certain stress levels. So another important portion of our care is we need to help protect in the beginning phase with ice. We ice down the area that's inflamed. And we also can use a lower back brace. You think of, when you go to Home Depot and you see the guys and gals there, they got these beautiful braces to help protect them. Well, during the beginning of care, we oftentimes utilize a lower back brace to help the patient feel supported so they're able to manage their day-to-day life, whether that's at work, whether that's at home. If their work is strenuous, we will limit the intensity and the amount that they are able to work, but the goal is to get people back to their work and normal daily living as soon as possible. So we'll oftentimes use bracing in the beginning along with ice to help calm down the inflammation. I wanted to review with you guys the phases of care because this is really crucial when someone has sciatica. We're going to come right up over here and share with you a visual representation of the typical care plan for someone who has sciatica. So the patient starts here day one, and for the patient we showed you on the x-ray, her nervous system at best was working at 72%. And I asked her and her husband, I said, well, what percent do you want to be functioning at? And she smiled, he laughed and said, of course, we want our mom, our wife, to be at 100%. And so this is a path. In the beginning phase of care, these first 3-4 weeks, it's called initial intensive care. You call it help with the inflammation, help with the pain. Most often, men, when we start feeling some relief and the inflammation calmed down, or maybe even pain gone altogether, most men, when we get to this point right here, we have a decision to make, and we usually make the wrong one. We stop care prematurely. And if the patient stops care here, they're definitely not getting their nervous system to 100%. They're gonna slide down, and eventually they're gonna get worse. So we continue with what's called corrective remodeling and strengthening. Now this process often takes weeks and sometimes months to years. Every month we re-examine the patient to make sure we're seeing progress. On that first visit we had done specific testing. The chiropractic, the orthopedic, the neurological and postural tests. We'll do these every month to see the progress. So not only are we symptomatically doing better, but more importantly mechanically we're addressing the problem and we're correcting the problem. Eventually we'll get to a stage of care where the doctors in our clinic will say, this is as good as we're going to get you. We'll do the tests again, and we'll also, importantly, take new x-rays. So we'll get a new set of x-rays. And during those x-rays, we'll have a chance to study and analyze them. And then we can review and compare to the first visit. Now the majority of our patients, when they get upwards of this tier in their care, they all ask the same questions. They ask, Doc, well, they actually make a statement. They say, Doc, I didn't realize how bad I was until I started feeling this good, and I don't want to go back to there. They ask, what can I do to stay here? And that's what's called maintenance care, where you're checked from time to time so you don't go sliding back down to there. We're going to review here in a little bit what manual decompression looks like and what we do in our clinic specifically to help with sciatica.